Welcome to Widemindedness with Victoria Ball, the podcast in which I interview expert guests who want to join me in celebrating that life is not black and white. Our society is increasingly divided, and the us versus them mentality seems to dominate our conversations and relationships with others. I believe that life is much richer when we widen our minds to consider multiple opinions and perspectives. So challenge your assumptions and let's become truly wide-minded together. Dr Jonathan Pearson-Stuttard, FRS-PH, is a public health physician and epidemiologist at Imperial College London. Since completing his medical training at the University of Oxford, he has been awarded multiple competitive clinical academic research positions from NIHR and the Wellcome Trust. His research has two main streams spanning non-communicable disease epidemiology, using big data and simulation modelling of health, economic and inequality outcomes to inform public health policy, and investigating the increasing multimorbidity and diversification of patients with chronic diseases such as diabetes. He was Editor-in-Chief of the Annual Report of the Chief Medical Officer 2018, Health 2040, Better Health Within Reach, which made several key recommendations, including the development of a composite health index, which is currently being developed by the Office for National Statistics. Jonathan is also Vice Chair of the Royal Society for Public Health and Head of Health Analytics at Lane, Clark and Peacock, and regularly comments in the media on a range of research and policy issues. As you can imagine, in 2020 he was pretty busy advising government and other bodies on COVID and the national response, and he has just co-authored a book with Dame Sally Davies called Whose Health Is It Anyway?, which looks at the impact that COVID-19 has had on public health. Dr. Pearson-Stuttard, thank you so much for joining me on the Widemindedness podcast.
It's a pleasure to be with you, Victoria.
Can you start by telling me and the listeners more about your areas of research?
Yes, so I'm a public health doctor and epidemiologist up at Imperial College London. And there's two areas that my research really focuses on. The first is around how patients with chronic diseases, such as diabetes, how their way of experiencing diabetes, their impact on their own lives, on the health system has changed over time. Patients such as those with diabetes are living longer, but actually greater amount of their life in ill health, and that affects both their lives, their ability to work, and the impact clearly on that health system, and this growing sense of multimorbidity, living with several chronic diseases at once. And the second area of my research then is much more around the policy aspect, whereby we look at what types of policies might have the greatest impact on health, but also on inequalities across society. And we model different types of policies and what the impacts of these policies will be according to health, economic, and inequalities for different parts of the populations.
How different aspects inform health policy is so relevant to anyone who has lived through 2020 and now in 2021 with the global pandemic, how we think about balancing those different aspects of society. Why do you think it is so important to take a broad look at different data to inform our understanding of health?
Well, you're absolutely right that what the pandemic has done is to really highlight how intrinsically linked our health is and our illness with everything else that we do and take for granted sometimes in society. So collectively, what the pandemic has shown is how vulnerable we as a nation or we as communities are to our collective ill health, that our society, day-to-day normal life has been totally turned upside down, clearly the big economic impacts. But actually, in a book I recently wrote with Sally Davies, the former CMO, we turned that on its head and said, rather than illness always seen just as a cost or a drain, that actually good health is actually an asset to our economy nationally, but also to communities and to each of us individually. And when we explored that, we find that this is because whilst living longer, we're all living collectively with more chronic conditions. And so that role of being in good health for longer is the key to being able to work, to having no barriers to the types of jobs we might want to do, learning earlier in life and throughout life, but also just to enjoy life and care for our loved ones.
And that book that you mentioned, Whose Health Is It Anyway?, which is now out, as you say, it outlines why health is a sort of untapped opportunity for prosperity and happiness in the 21st century. And I think there's sometimes angles that we don't associate with the sort of hard data of sort of clinicians. Can you explain a little bit more about why you think what I would call as quite a wide-minded approach would be a good way to underpin a new kind of health system?
Yes, absolutely. And this all starts really with our view of health, which in the book we call total health, or health with a capital H, which is that it's both physical, mental, and social health. And again, that isn't illness, it's actually each of those being in good health. And that is very different for everybody depending on their stage of life, but broadly means that it's not interrupting what they would like to do day to day and isn't holding them back. And so when we then take that step back slightly, we look at what the data is behind this and why this total paradigm shift really of instead of seeing illness as a drain to seeing health as an asset and an opportunity is that some really interesting research over the last few years around the role of health across other aspects of inequalities, for example. So when we look across England, what we tend to find is that in areas across England, and is the same for the other devolved nations across the UK, that areas that have the highest unemployment rates also tend to have the lowest levels of education and also tend to have highest levels of poor health. They tend to cluster. Now, we've all known for quite a long time, clearly, that education is vital as an opportunity for prosperity, for social mobility, and so forth. But that some of the really striking data that we found is that actually health is now a bigger predictor of economic opportunities, employment opportunities, than education itself. And so when we then work backwards from that, we think, well, take childhood obesity, for example. Children growing up in the most deprived 10% of neighborhoods have double the rates of obesity when they start school at reception, and almost 4 times the rates of obesity by the time they go into year 6 than their most affluent counterparts. So that means right from the very outset, this opportunity that health provides to learn, to go on in terms of employment opportunities and so forth, is far from equal right at the very earliest of ages, and that plays on throughout life. So we really come back to thinking, well, why would we see this as an opportunity? Well, clearly as an individual, and whose health is it? We talk about as individuals, that's a real opportunity for healthier and happier lives. But also when the governments across the world look at these 2 big challenges that they face. One is that healthcare generally is increasing in terms of costs year on year. In the UK, almost 1 in 4 pounds that are spent on public spending is spent on health. And it's even higher when you then look at social care and health-related benefits. So if we keep going on, that almost becomes unaffordable. But on the other side, we're also seeing real big social issues rising to the top of the political agenda. Of course, in the UK, the current government was elected on the idea of levelling up. And so what we say is actually that health is a real opportunity to level up, not just for health, but that would play through to education, to employment opportunities, prosperity, and of course that comes with that happiness.
And that's interesting because I think people sometimes think of keeping in good shape or in good health as something that's a bit boring, that they don't really want to do, and it's sort of seen as a bit of a negative. But you're reframing that and saying that there's an opportunity for a better life.
Exactly that, and it's what we're also sort of stressing within this is that it is the opportunity for a happier life, for more prosperity and so forth, but that even that opportunity is very unequal, and that's really important too, because so often things like obesity and other aspects of that, which if you think of obesity, it tends to set on much earlier in life than many other chronic diseases. And it then leads to other chronic diseases themselves and many health complications, which throughout working age life impedes many of those other aspects, such as employment. Whereas the chances of becoming obese, for example, are so much out of an individual's own control. If you live in a neighborhood that has higher density of fast food outlets, for example, or if the food in your if you're living on a relatively restricted budget, the food that's often most accessible, most affordable, and most easy to prepare is often the unhealthiest. And so providing that opportunity of health, we must make much more equal, which clearly the NHS has a part to play, but then actually that wider environment that we all live in has such a vital role too.
Mm. Yeah, and that really comes back to that point. I asked you about holism and healthcare, but that's really holism in society and looking at health and how it fits into the whole way our society is structured and the fabric of society.
Exactly that. And it's really interesting because what the pandemic has done is highlight many of these inequalities. These inequalities aren't new. In fact, many of them have been both around for an awfully long time, but getting worse. And if you look at some of the health data, life expectancy, for example, in women, the difference again between the most affluent 10% and most deprived 10%, it was 6 years in 2010, and that worsened to 8 years by 2018.
Mm.
But then if you look at healthy life expectancy, that's double that. That the gap is 19 years between the most affluent 10% and most deprived 10%. So there's an unequal opportunity to living and living longer, but actually being healthy and the opportunities you can have of being healthier are even more stark when we look at that. And the
Mm.
pandemic's really highlighted this, both in terms of those individuals, whether it's deprivation or certain ethnicities, having higher risk of getting COVID-19 than having a poor outcome from COVID-19. But also it's many of the same communities who also have been at higher risk of redundancies and many other social and economic factors that will clearly hit during the pandemic, but that will only see the full and true effect of that in 12, 24 and 36 months to come.
I'm just jumping into my conversation with Dr. Pearson-Stuttard to remind you that you can listen to all of the super diverse, super brilliant guests on the Widemindedness with Victoria Ball podcast. Wherever you listen to podcasts, be it Apple or Spotify or Google, you will be able to find it. You can also follow me on Facebook and Instagram at Widemindedness Victoria Ball. I'm so thrilled to have you on this wide-minded journey with me. And to mention the pandemic there, which is just an inescapable part of the health landscape of the past year, Spain, England and Wales top the list for coronavirus mortality. In a recent report, you examined the first wave of the COVID-19 pandemic, and I think you were looking at 21 industrialized nations. What were your key findings from that? Did that play into your theories and what your findings about the fabric of society and health as well?
Well, it really did, because we looked, as you say, across these 21 countries, many of them in Europe, from middle of February through to the end of May. And we looked whether their mortality rates had increased or decreased and how that ranked across those countries. And what was striking was there were around half a dozen countries that saw really no increase in deaths in that 2.5 month period. So no excess deaths to what would have been expected ordinarily. But at the other end of the scale, as you mentioned, England and Wales, Scotland, Spain and Italy are up around 38% more deaths in that 2.5 months period that would have been expected. Now, clearly, the obvious thing to do is say, what are those policies that governments had around COVID itself? And what we did find was they clearly did have an effect. Those countries that locked down at an earlier stage of the pandemic tended to have better effects, but also those countries who had test and trace systems that carried on. But that if you just focus on that, we think you're missing a lot of the important drivers and looking at it in the round. So the two other important factors were really how you value health and the road of healthcare before the pandemic. So firstly, if you look at what was the health of the public like when the pandemic hit. So in the UK, for example, we have some of the highest obesity rates in the world. And we all know, sadly, that those who are obese have a much higher risk of having poor outcomes from COVID. These are structural issues that have built up over many years. The same with multimorbidity, relative deprivation, and things like that. And then that third area was, what was the resilience of the health and social care sector, again, at the start of the pandemic? And again, whether you look at its ITU beds or ventilator numbers or the capacity across social care, generally the UK was found wanting on there. And so really, of course, the policies at the time were really important. And there's lots that governments could learn from that response to the first wave for this second wave that we're in now. But it also shone a light on how have governments valued the health of their nation. And that sadly, those who had valued it, put that first and foremost and had healthier populations had done much better than those such as England and Wales, which have had much poorer outcomes since then.
Wow, that's fascinating. And such an eye-opening piece of research that people do need to listen to and sit up and listen to. Throughout your career, not just through this report, you've done so much research into multimorbidity. Can you help us to understand from a medical perspective why so many conditions are interlinked or coexist?
Well, it's a really good question. And so that the premise of multimorbidity is a relatively new one, but clearly at its core, it is people living with more than one chronic condition. And that there's two sides to that. There's those who live with lots of chronic conditions, all of which are related to each other, and then those that aren't related to each other, and both of which are important, but with different implications. So a classic one is, for example, patients with diabetes tend to have higher risk of getting heart disease, stroke, lower limb vascular issues, because it's a similar kind of process that leads to those diseases. And what we've done and been very successful in the UK and across the world is we know that diabetes leads to that high risk. So there are secondary prevention efforts that reduces those risks. But alongside that, we're also finding that as we age, we also get several other chronic conditions. Now, some of those may well be related to our index condition like diabetes. There's increasing evidence, for example, diabetes increase the risk of liver disease and cancers. But many of them may not be to do with the diabetes at all. You might have back pain, you may have depression, you may have other conditions, for example, asthma and so forth. But what we do know is that there's an increase in patients living with many more different types of diseases. And at its heart, that's because actually it's a sign of success of the NHS and of modern medicine. We've been extremely successful at keeping people living longer and specifically focusing on certain diseases. So our health systems generally coalesce around, for example, vascular disease. So cardiologists have done a fantastic job, both in the lab doing the research, right through to at the bedside with the patient, of improving survival in patients who have heart disease. But what we need to start doing now is going much broader than that and realizing that patient with heart disease, the patient with diabetes, they have many more other conditions. And what matters both to the patient, but also clearly for the health service aspect as well, is to be a little bit more holistic in how we view patients' care, how we view their prevention, and how we develop treatments for patients going forward.
Now, some of those coexisting conditions people will be familiar with, such as diabetes or heart disease and obesity. But I was interested to read in your work that you've made a link between obesity and cancer. Is that right?
That's right. So there's been increasing evidence from the World Cancer Research Fund and others that both having a high BMI, so those who are overweight and obese, increases the risk of around 11 or 12 different cancers. And for those with diabetes, there's evidence of increased risk for 6 site-specific cancers, and some of the commonest cancers they are. So some of the work we've done over the last few years at Imperial is to actually try and estimate how much of the cancer burden across the world is attributable to high BMI and to diabetes. And all in all, we estimated that around 800,000 cases each year across the world were due to high BMI and diabetes, with much of that being preventable if obesity rates and diabetes hadn't increased the way they have over the last 30 years. But what the really key bit and what I'm really interested in the next few years and decades of my work is sometimes in public health generally, we're really great at defining the problem. And I think that's an example there where we're identifying what the problem is, estimating the numbers, estimating that impact on patients' lives and also the health system. But we need to transfer that, not just defining the problem, but actually then creating actionable solutions. So, for example, with patients with diabetes at the moment, we know about these increased risks of cancers. It's unlikely to be in everybody who has diabetes, but we don't yet know who is at more risk than others. And so because of that, there's not a huge amount that we're doing to reduce that risk in patients with diabetes compared to others. So if we can identify some of these more, what we call sort of actionable insights, what is it about somebody who might have diabetes that would increase that risk, then we can do something about it. Implement specific screening or prevention efforts and really reduce that risk properly in patients with diabetes or high BMI.
It's fantastic that you make that link of going the next stage to suggesting solutions, because of course all suggested policy changes do have to be grounded in the science, and in otherwise these solutions can not address the right thing. So I completely understand that. And I think during the pandemic, people have become frustrated because they maybe listen to the news every week and hear new pieces of medical advice or the policy implications that might have on their day-to-day life. And they say, well, the scientists keep changing their minds. How are we meant to understand what to believe? For me, that's quite indicative of a sort of lack of wide-mindedness in society and in the way we're educated as well, that we're not very good at understanding that facts change as new evidence is unearthed. Is that something that you're familiar with in your field?
That's absolutely right. And both within the pandemic, the idea that, as you say, within a few weeks really of first ever hearing of this virus, COVID-19, that clearly any science that was being developed and by some of the very best scientists in the world, but all of it is on very little amounts of information. So clearly we'll have high levels of uncertainty, which I'm absolutely sure the scientists will have been conveying to decision makers. But clearly some information, and the best information we have, even if that's a little amount, can help inform the decisions. And as the information changes or evolves, that advice and so forth will go with that. But one of the things we tend to find in our policy research, and when we're doing when we're estimating the impacts of different policies, for example, is you can imagine we take populations and then we take a policy and we estimate what the impact of a policy, for example, you take the sugar levy, what the impact of the sugar levy might do to the change in purchasing then of soft drinks, what that might then do to the change of sugary intake for individuals, feed that through to change on things like obesity, feed that through to health events. So there's a lot of uncertainty at every layer of that. And one way to tackle that is say, well, there's too much uncertainty, we won't do anything. But what we tend to do, though, is to incorporate each element, to incorporate the uncertainty around it. And so the estimates we give have quite large uncertainty estimates. And again, what we tend to find is we try to sort of encourage people not to focus on the third decimal point of a very large number that has been developed with this uncertainty. But what we can tell is, well, the trend is suggesting that this would be better, this would be worse, this would improve inequalities, it would worsen inequalities and so forth. And that's often something within epidemiology and public health that we tackle with.
So drawing on your field and your expertise, is there anything you could suggest that we do as individuals, either in regards to our own health or our use of data or our understanding of data perhaps, that you could suggest that might help us to become a little more wide-minded?
So I think it's really interesting and obviously a time for reflection at the period we are after the pandemic. And often I think if we each sort of sit back and look at what the role that good health has in each of our lives, and similarly think of, when we think of health, what are the first words that come in? Is it illness? Is it the NHS? Or actually, is it what we can do with health, being happy, going about our normal day-to-day life and so forth? And I think really appreciating that. And then the other aspect is as well, of course, is to think through, what does being healthy mean for me? What does it mean for my family, for my mother, for my children? And that being healthy means very different things to different people. And that changes as well what we mean by total health. And for example, for people who are elderly, often actually being healthy doesn't mean controlling their glucose or controlling their blood pressure as perfectly as we might want to in someone who's middle-aged. It means keeping them living longer independently so they can enjoy life at home for as long as possible. And having that more sort of holistic view, both of what health means, but that it means different things to each other. And finally, I'd add that there's a really interesting development from the Office for National Statistics that I think is really fun to explore. It's called the Health Index. And this was something that Sally Davis recommended 2 years ago that I was involved in. But that when the ONS have published this, it shows the stock of health for your local community. So you can go on, you can put your postcode in, and you can see how your local stock of health outcomes, risk factors, and healthy places, how that's changed over time and how it varies compared to neighbouring local authorities and things. And I found it really interesting just to explore what makes up our local community stock of health and what that means for me and my family.
Dr. Pearson-Stuttard, thank you so much for joining me. It's been a fascinating conversation.
Thank you very much, Victoria.
Thank you so much for listening to this episode of Widemindedness with Victoria Ball. I really hope you enjoyed it. Please let others learn about it by rating, reviewing, and subscribing. For more great wide-minded content, follow me at Widemindedness Victoria Ball on Facebook and Instagram, and sign up to the monthly newsletter at victoria-ball.com.